Hello and welcome to News Update. We have an interesting new update story and sharing for everyone. So the news that we have discussed today is issue of a third of first year's university students face depression and anxiety. There were 7 people who joined and exchanged the ideas on this issue, following by Soryut, Amri, Abbas, Hansala, Fadel, Hafid, and including me. Let's be talking about the information first. We have released new from the Healthy Food website and has reviewed information according to new research that as many as 1 in 3 first-year university students have or will develop moderate to reverse anxiety and depression. The study published in BMG Open found at NT the university 30% of students reported moderate to severe anxiety symptoms, and 27% reported moderate to severe depressive symptoms. Additionally, an increase in drug use among students without mental illness was found to be a risk factor for development symptoms. Oh my God, I think it is very shocked to have such an impact like this. So what do you guys think about this issue? Maybe we can try to share some information about this. So have anyone want to share about this information?
Me, in my opinion, the most common reason that provoke the onset of depressions are the presence of genetic risk, psychological and coexisting adverse circumstances are all three factors. First, depression is caused by stress. However, people who have no relative who have ever been sick may develop this disease. Often found that patients with this disease have abnormal level of chemical that brain cell produce to maintain emotional balance. Then the mental state of parenting it is another risk factor for depression as well. A person who lack of self-esteem see himself and the world in which he is constantly negative or easily stressed when faced with the monsoon of life all made them have a chance to get rich more easily. And finally, coping with the dire situation. For example, if life experienced a major loss, its relationship with close people were not smooth or need to be changed in a way that is not desired, it may encourage depression to relapse. And this is cause of depressions in my view. Anyone want to share?
Yes. For me, I want to share that the word that we must to avoid with the depression people. Okay, if you guys have a friend or family member struggling with depression, you might not know what to say or how to lend support. The single best thing you can do for a friend with depression is listen without judgment. So there are a number from phrases that are sometimes used with good intention, but can actually make a person with depression feel worse. So avoid these phrases when supporting a friend with depression. Okay. So all this information from Katie Hurley. Okay. Let's see for the first process. You don't say don't think about it because a person can simply with depression away, and telling a person to stop thinking about their problems can actually trigger them to engage in rumination. Okay, so let's say next, you don't say think positive. Don't, because telling a depressed person to think positive is dismissive of the medical condition that cause the symptoms and place blame on the person struggling with the disease. Okay. Okay, next, don't say, I know how you feel, because no one can know the feeling of other for sure. So this is not a helpful sentence to make depressed patient understand their depression. Last but not least, you don't say, it could be worse. Comparison to other people fighting other battles are really useful, although there are might to be other people suffering from any number of medical conditions. Telling a depression person that someone else has it worse only make that people feel ashamed. Okay, so last, you don't say get over it, because this kind of statement lack compassion and will likely make the person with depression feel shamed and misunderstood. Okay, that's it for my sharing. Anyone?
That is very interesting, Amri. I'm going to give some information about the symptom. I mean, a depression symptom. Normal people always think social anxiety isn't just it's just only shyness. But I will give you some information that social anxiety isn't just shyness. It can also be feeling like everyone is judging you, worrying about people can see how anxious you are, obsessively replying the thing you say and did, thinking you're boring and have nothing to say, believing everyone else is really confident, and needling alcohol or drug to feel more confidence, leaving text message unread for long period of time, and the last thing is worried about your burden and a waste of space. So this is all of things that people always think that we have or they have a symptom about the social anxiety. And the next one, please.
Okay. However, there are no perfect answer when it comes to supporting a friend or loved one with depression. And question can be just as helpful as statement with a depressed person open up. Try a few of these apathic recording. Example, how can I help you during this difficult time? And next, I'm sorry that you're hurting. I'm here for you. And tell me more about it. Would you like to talk? Would you like to take a walk with me? Can I keep you company today? Or can I bring you dinner this week? And thank you for sharing this with me so that I can understand what you're going through. And lastly, it would be great if you could say that, so say the sentence with proper action. Okay.
Okay. Today I would like to share 3 tips for managing depression in college student. Or the first one, spend time with your loved ones. If you have depression and anxiety, it can be easy to fall into the habit of staying at home unless you have to leave. But tasking yourself with visiting loved ones at least once a week will begin to get you out of the habit of saying no and keep your social listening. 2. Exercise. Exercise is not just for the physical benefit of maintaining a healthy body, but it also affects your mental health by raising your pulse. Exercise allows more oxygen to reach your brain, which help to reduce anxiety, depression, and boost your overall happiness. 3. Help other people. If you are having the worst day and a colleague or friend compliment a piece of work you did or brought your a drink when you feel too busy to make one yourself, you did feel so grateful. They may even written just that little bit. Okay, next. Okay, for me, I'm going to talk about method of treating depression in adolescent. When a teenager reaches the real crisis of having depression, they must be treated directly by a medical professional or hospital. From the research topic, adolescent depression, nursing roles by Psychiatric Nursing Department, Borough Rajashanani College of Nursing. In that research, it has been said that at the present there are several treatments for depression. Mostly, the treatment approach is a combination of different methods. The first method, antidepressant drug. This method is used for adolescents diagnosed by a psychiatrist as having severe depression. Most of them have suicidal thought or other psychiatric symptoms. Second method, electroconvulsive therapy, ECT. This therapy is used in adolescents who are unresponsive to drug therapy or who cannot tolerate its side effects or high risk of suicide. And last, psychosocial therapy. It is psychotherapy that focuses on manipulating thought, emotion, and behavior to reduce depression. This method is used for adolescents with or moderate depression. Thank you.
Wow, from what you guys sharing is so amazing information. It's about causes, symptoms, and wardens, including recommendation, which for me, I think if we have someone close to us that face this thing, there are three ways you can support someone with anxiety or depression easily. With three ways you can support. So the first is encourage them to see their doctor who can steer them toward the right service. And second, let them know you are there to listen and to support them. Listening meaning no judgment or interruption. And the last, don't try to solve their problems rather than telling them what they need to do instead to fit to their situation and let them know their feeling or wallet. And this is all we would like to share for everyone who listening our podcast. We hope you are enjoyed and gained knowledge with us together. Thank you.